Hello, hello. Good evening.
Hey, good evening. Hi,
It's good to see you, Dr. Flannery, and everybody out there in Facebook world. We are delighted to be coming to you tonight to talk about our new working together and a new affiliation to be able to help people improve their lives, like we've been doing kind of separate, and we've been working on projects together, and now it's more official. So I'm really excited.
I'm delighted. Thank you. It's really a privilege.
Oh, well, thank you. So Karen, why don't you tell us a little bit about you and your history, and as much as you want to tell us.
Okay, my pleasure. Thanks again for the invitation. This is so cool. I'm very excited. Any opportunity to collaborate with Jeff and the team at Pathwaves, I've had nothing but positive experiences, positive energy. Even just hearing his voice or a text popping up always brightens my day. And same with Ryan. So a little bit about myself. So I Dr. Karen Flannery. I'm a physician, internist, internal medicine by training initially. I've been practicing for almost 20 years in Palm Beach County. So I'm from Chicago originally, and went to medical school in Chicago, came to Florida because it was just too cold, residency in Tampa, USF, and then and so practicing internal medicine actually for the first about 18 years of my career as a hospitalist. So hospital medicine. I'm actually coming to you today from the library on the top floor. I kind of filled it up with all my favorite reads of Good Samaritan, where I've practiced for my entire career since training. So for 18 years, I was here as a hospitalist, so internal medicine, but taking care of acutely ill patients in an emergent or acute setting in the hospital. And I kind of lived and breathed this place. And my kids were born here, and they went to preschool here. And my daughter comes back and volunteers here. And so I love this place. So I'm certified in hospital medicine as well as internal medicine. But also this floor, the fifth floor, as Jeff knows, because we've had some experiences up here together with some patients, that it's a concierge level floor. So it's sort of it's a combination, I guess, of best of both. All the hospital services that one could ever need, but also concierge level hotel or home-like accommodations, furnishings, a whole different chef's menu, and a whole lounge, library, little workout area, my little Zen zone, some yoga, meditation, things like that. And so just one little part, like 3 beds of this unit, is dedicated to detox patients. It's called The Palms. It's been open for about 10 years. I got involved with it peripherally and then transitioned. I got away from full-time hospital medicine, started doing this about 2 years ago full-time, and I created Palm Beach Wellness Institute, which is my practice as an internal medicine and addiction medicine physician. But I realized over the years in doing detox that even though patients that come here, it's a high end sort of detox unit, concierge level. They don't have to kind of hang with the riffraff. They're just it's very, very sort of executive level. But it doesn't necessarily make things easier. And a lot of the folks also are more mature, 50s, 60s, I would say is more of our average age population. And a lot of them have been to treatment centers. They've struggled. They're kind of can't or won't, not willing to sort of go back into the whole sort of treatment cycle again. And so they come here. This is detox only in this facility. But that's where I've met a lot of patients over the years. And that's where I also kind of came to realize that that was not enough. I needed a team. So I created Palm Beach Wellness Institute and have been surrounding myself by tremendously inspired, positive energy people / angels. And I certainly consider Jeff and Ryan very close among them. But mostly because it takes a village. And when somebody's struggling in their recovery, self-medicating, it's the substances, of course, it's a big deal, but it's what's underlying that, getting to the root of why people feel that they need to self-medicate with drugs or alcohol, to calm the mind, to be able to sleep at night, to cope with stress, depression, anxiety. And so this is, of course, becoming a more and more relevant theme these days, even if there's not really a self-medicating component to it. But with our current pandemic and just all the pressures of life, even that younger people now are facing, my kids are teenagers, having to grow up and kind of play adults sooner than I think we had to when we were kids. It's a stressful world we live in, and then just add a little pandemic on top of it. So it just actually is a blessing that prior to all this, pandemic, I had really surrounded myself with people that can bring additional resources, whether it's recovery coaching, of course, psychotherapy, lots of holistic practices, acupuncture, massage, energy healing, Reiki, yoga, and Qigong. We do things a little differently too. We kind of like to make up our own rules. And so we'll do pretty much everything we do is one-on-one, individualized with patients. But, we may do Qigong on the beach or, walking meditation, something like that. And so really focusing on wellness. I think I'm trying to remember how I came to Jeff actually in the first place. I can't even remember now, but I do remember that you were right there when I needed you. Perfect place, perfect time in my life, and not just for myself, but for patients. But I take my referrals and recommendations very, very seriously. And not that I have to necessarily vet every treatment protocol that I refer a patient to personally, but this one I did. So I hooked up with Jeff and Ryan. I don't remember how long ago, maybe a year and a half or so ago. And I said, this is very intriguing. What these guys are doing sounds incredibly cool. And oh, by the way, I did a bunch of neurofeedback prior to even meeting them. And I was like, okay, this is very interesting. I think I noticed maybe some help, but I remember asking, okay, what am I supposed to do in these sessions? Before I came to Pathwaves, what am I supposed to be concentrating on, focusing on, attempting to achieve here? And I was told nothing, just sit back and just kind of let it happen. And I said, I'm kind of a doer, I know I'm supposed to just be, but I'm still a doer. So I needed something to kind of keep me engaged. And so I found out about this. I decided to explore it. Ended up doing I think at least 20 sessions with you guys myself. My daughter, who's now 16, who was also in a really tough place a couple of years ago while I was making a big transition in my career. I was sort of a mirror for her and vice versa. And so we kind of both sort of, crossed, paths on our journey, if you will. And Pathwaves was just right there when we needed them. So it really opened our minds and our hearts up to, but also my brain, the inquisitive, intellectual sort of curiosity side of my brain, to say wow, what else can we do? I mean, there's a lot of stuff that we've been doing for years, the same old kind of treatment regimen, same old psychotherapy. There's got to be a different, cool approach that I wouldn't have actually ever thought of this myself, but to be able to blend so beautifully and so naturally, mindfulness training, holistic approaches with ultra modern technology on such a personalized level, and just the way that Pathwaves brings in coaching, psychoeducation, and really just helping each individual, not a group, it's not standardized across the board. Some of it is, of course, but helping me understand my brain, helping my daughter understand her brain, helping our patients that we brought to you understand their brain, how it works, what's not working optimally about it, and then how they can modify that, and that we do have a huge element of control in terms of neuroplasticity, being able to really focus on what our priorities are and our core values, utilizing our own strengths. And you guys you have your finger on the pulse. You've had it from the beginning. I am forever grateful for what you've done for me and for my family and for my team here, Palm Beach Wellness, our patients, and really just this career path. So yeah, you guys have been sort of doing your thing. We've been doing our thing. And I'm like, Jeff, we got to get together. What are we going to, how are we going to make this, something we can really, really partner in? Because this is honestly something I believe in. I believe in it with all my heart and my mind and my brain and all of the above. And I really want to share it with others who can, totally benefit. Sorry, that was a really long answer to a really short question.
That was awesome. That was awesome. Usually I got to ask a lot of questions. I got to guide people. I'm like, I just open the door. You're already.
Sorry.
So, you and I met because a very person close to me went through your detox. And
of course.
I have to tell everybody that Dr. Flannery is an amazing, not just an amazing doctor, she's an amazing individual and really cares and is really involved. And that's not just a bedside manner thing, and does amazing work. Originally it was, when I first became associated with it, it was just detox. Mm-hmm. And I remember you kept telling me, oh, I've done neurofeedback. And actually you've been to some of the top centers in Florida. And I was just like, yeah, look, they do great work as far as neurofeedback. However, I'm doing something very different. Mm-hmm. And, it's so hard to explain. I think you kind of nailed it though.
Oh, but remember though, I challenged you in the beginning. I talk about asking questions. I asked you about 1 million questions and I was like, come on, man, explain this. Like, talk to me. You got to show me something. Where's the science? Where does this come from? And so some of it was just, believing in the spirit, the people, the energy. Definitely. I mean, going in, first of all, walking into your center, there's no question. There's absolutely something powerful and spiritual, magical, whatever you want to call it. Just a very incredibly positive energy in that center. And even though we're up in West Palm, I think I did, the vast majority of my sessions, you offer doing them remotely, which is super, super cool. But, to jump on the bright line and come and see you guys was like, the highlight of my day. And my daughters, she had the option. She's like, what, it's so cool going there, and seeing them. A lot of what we do in our practice, and we're obviously we're more centralized, I guess, in West Palm and Palm Beach County. So it's a hike, for our patients to go there, for you to come up. But like at the drop of a hat, I mean, whenever I've called you guys for patients in need, whether they're in the detox unit or in their home, can we set something up? Like, they're like, yeah, absolutely. Let me look at my schedule and shift some things around, and voila, like you're in their homes, giving them personalized, customized concierge treatment and support and care, and opening up your heart to them from the get-go, wanting to really know where they're coming from, what's their story, where are they kind of stuck in their journey. And you've come through every time. And that I don't know that you could actually plan it any better. It almost just is sort of organic, the way it all kind of comes together. And I think that also holds true for sort of our professional and personal relationships too, with you and Ryan. So just really forever indebted.
Yeah. So when you say organic, the first thing we do is map a person's mind and tell them their history of their neurological function, how that's affecting how they function today. And so it's organic from them. So I'm looking at their origins and all of their development.
Yeah.
And of course, that's a great place to start. And what's exciting is we get to do that, in an hour? I can tell a person pretty much their history of neurological effect, and then say, hey, where do you want to go from there? Yeah. And I really kind of want to stress that when I first met you, it was just addictions, but now you're in total wellness.
Yes.
And now you're traveling. You've got a team of professionals, like you mentioned, that aren't just at your center. They go to people's houses. They go to other centers, as we do. And so we're traveling to different places together. And I think that's a really big important point. That you don't have to leave your house to get help. And that's a big scare these days with COVID and everything,
Sure.
And we're very COVID safe. We're all tested. We're all wearing masks and gloves. And I would wear a hazmat suit, but that's going over the top. And, it's exciting for me. We have 2 licensed mental health counselors on our team. We have two executive life coaches, because I just got certified. And now we have 2 doctors on our team. We have another internal medicine doctor, a cardiologist, and has a certification in aging medicine. Mm-hmm. I call it longevity, but I'm not allowed to for some reason. Anyway, evidently that's not what you say in medicine. And now I would say you're a premier addictionologist, and just really, really strong on all the medications and all the possibilities that are needed during, detox or other cases. And, now with our team, I get to give you that neurological reading. We get so much more insight together, and we're able to, really treat holistically from a lot of different angles. And, you kept mentioning, it was kind of strange for a doctor to say things like spirit,
right?
Spiritual energy, that's fantastic. And so I just really wanted to really highlight that about you. You're not just that medical doctor, you got to stay there,
Yeah.
You're very open and willing to talk about, different ideas. Of course, you stick to the medicine and you stick
Well,
to
I
the
do.
real.
But, I wasn't always that sort of, open-minded and spiritual. I like to tell the story because I have to give credit to, the people that I say sort of saved my life or, brought me, new approach to life. And, we all sort of go through our, I don't know if it's a midlife crisis or career shift or whatever, burnout. I guess I probably was suffering. I know I was suffering from burnout. I didn't even realize what it was. The person who first sort of came to me was someone that said, would you like to try doing some energy healing or Reiki or something? And the old Dr. Flannery would have been like, sure, show me the, placebo controlled, double blinded, randomized, that Reiki helps with whatever this condition is. And, but I remember I just kind of did this and I was like, okay, like I thought I had it all figured out. I don't have it all figured out. And I think that maybe there's more, that can be done to support people emotionally, physically, spiritually, whatever. Even though it didn't feel like a spiritual thing at the time, but I just remember sort of getting, sitting up from that experience saying, it's my mind, like my mind is open. And then once I had that mind that was open and all it took was just that there are people that have other talents for healing, right? And for connecting, because we're all that's what this is all about, is human connection, right? And so something as funny as like pathwaves and neurofeedback, where's the human connection in that, right? Or even spiritual, it's like it's electrical. And but it was so quite the opposite once I went in with that open mind. If I had tried it maybe 5 years before, I would have been like, I don't even know what all this stuff is. And maybe it would have appealed to me because of the scientist in me, I'm not sure. But I know I got to you right when I needed you, and I was like primed, and I just said, give me everything you got, teach me, test me, show me, train me, and it's going in open. And so that would be really my biggest recommendation for anybody considering doing this kind of work. Is it's a big deal. It's an investment of your time, your money. It's well worth, it's absolutely well worth every penny that I spent for myself and my daughter. I would recommend it to any patient, but you don't go in lightly. And so the one thing I think Ryan mentioned to me recently about what you guys are kind of doing a little bit more of is maybe just having some initial conversations, with clients or potential patients that are like, yeah, why don't we just kind of talk about what this might look like for you, or try some sort of coaching and a little bit of the educational piece. I don't know that you totally get the feel until you kind of really get in there, do the brain map, and once you guys are able to tell me or tell individuals, like you said, what you can see about brain activity, where it's coming from, what's not firing, the way best that it could be, then you're kind of like, okay, I see where we can do this work from a technical perspective. But it's the human connection that's always what brings people together, and it keeps that relationship, that professional and therapeutic bond, solid all the way through and far beyond, as you can tell.
Yeah, thank you. And well, you said you don't know everything. I want everybody to know that you know a heck of a lot. Everything we talk about, I get so much great information from you. And I want to say hello real quick to Jennifer. Hi, thanks for tuning in, and Lily. Jennifer. And Lily was commenting that we're giving out excellent information. Isn't that cool?
Good deal. Hi, guys.
Awesome. So anyway, So the process that we go through is like you said, multiple sessions, but it starts with that mind mapping, which we can do again anywhere. Did I do your first one up there in Palm Beach?
I don't remember. Maybe, I don't know. I love going to you guys, though. It's so cool there.
Yeah, well, I like coming up to you too. I like to take the Bright Line because I hardly ever do that, and you give me a good excuse to get up there to Palm Beach.
Indeed.
And so we've helped people with depression, anxiety, with sleep issues, with agoraphobia. They're scared to leave their houses, which may be more prevalent now from COVID.
Oh, yeah, absolutely.
And all sorts of different issues. And what's great about having you on the team is now that we can get complete medical readings too. We can do blood analysis. We can see if there's hormonal imbalances, and you can prescribe medications. As we're working on our side, the body may need help to update some of the areas of our hormone balances that aren't up to speed because we haven't used them in a really long time, or we've been medicating something we're trying to get off of for a really long time.
Yep.
And and being on some medications, either prescribed or not prescribed, often can cause our physiology to not be able to function the way it at its optimal levels, and the medications help with that.
Yeah.
So it's great to be so holistic and to be doing both kinds of work. And the other big thing that's going on for everybody is that it's an election year, and people are freaking out about that too. And again, we can help calm down the elevation in anxieties and worries about what may happen.
Yeah, fear the unknown for sure.
So that's a big thing that's going on now. I mean, it's almost a perfect storm right now. We got the COVID, we got the economy, we got elections. I mean,
indeed.
It's hard to be as happy and joyful as you are.
Thank you. Well, one thing I can say I tend to remain is passionate, passionate about everything I do personally from, with my family, and absolutely in patient care, and I'm probably the biggest patient advocate you'll find from a physician standpoint, making phone calls, trying to just play perfect matchmaker, get them, hooked up, not just to you guys, but like, hey, Jeff, Ryan, this is this patient. This is what I think. Like, let's talk about their story. It's not just sort of a refer out kind of thing. And that's why even like in my own practice with Palm Beach Wellness Institute, what we do is really, I guess our tagline is it's a physician-led integrative wellness team. And so rather than, me as a sort of more open-minded, maybe holistic physician referring somebody out to a therapist or out to have acupuncture or, energy healing, I kind of brought it, sort of all together, not necessarily under one physical roof. We can do that here, for example, in the unit, but maybe under that person's roof. And so, we develop programs that, for somebody that's really in need, struggling, lots of trauma recovery, multiple substance use, some physical conditions. I love working actually with older, patients. I have a handful of patients in their 70s that are doing super, that never thought that they could change. I mean, maybe you can speak to the idea of neuroplasticity and the capacity for change, but I love working with that age group. And as an internist, so I'm not a psychiatrist, right? I'm an internist by training. And having taken care of the sickest, patients, critical care, end of life, things like that over the years, I actually really enjoy helping patients. One of the things I liked best, I guess, about my practice in hospital medicine for all those years is educating patients and family members, kind of just distilling it down, helping them understand their condition, maybe what got them here, what underlies it. And, one of the things that I realized in hospital medicine is probably not too dissimilar from outpatient or primary care, is that, vast majority of adult sort of medical conditions, not just psychiatric or behavioral health conditions, but true medical conditions, high blood pressure, even strokes, diabetes, are from the way we process, stimuli in our environment, right? And at a brain level. And so if we can help people understand how their brain is synthesizing these various, everything that's getting thrown at us, and then how that translates into our own behaviors, choices that we make about how we nourish our body, how well we rest at night, and how we're able to calm the mind, to be able to respond rather than react. I think I was like poster child for reactivity. I mean, ask my kids, like, they kind of were like, Mom, like, what happened to you? What are you on? Like, I'm still energetic. I'm still passionate about life, but I don't tend to kind of just flip, and just that compulsion, right? That I think we all have at times, where it just feels so good. Like, how can you not just react, right? Like, you got to get that jab in there at that moment.
Actually, let me address that real quick.
Yeah.
So neurologically, in our brains and actually our bodies, but we're taking everything here from the brain, there are certain neural pathways and certain areas of the brain that are reacting to whatever our senses are telling us. And those reactions, often through the amygdala, are the response is before we're aware of it. So like you're saying, you're just always reacting, and then you're just like carrying on the reactions.
Right.
And what's beautiful about what you were saying earlier is that in neuroplasticity, we can actually train our anatomy, like the amygdala and all the neural pathways that feed the senses and the perceptions and understandings that our senses are then telling us, like, what am I seeing? What does it mean to me? And what am I hearing? And what does that mean to me? We can train them to react the way we want before the reaction happens, which is part of the process, which is why now, you are able to train that part of your nervous system, the fight and flight, the sympathetic, they call that medically, and a big part of that, the nervous system, to not respond out of so much fear, to respond with the confidence and understanding of who I really am today, and as long as we can learn, our neuroplasticity allows us to make neurological change. That's how simple it is. So no matter how old you are, if you can learn something new, then you can actually affect change. And it just takes repetition. What our system does is it helps you create 100 to 1,000 times more repetition per second than you can on your own. It's a big part of the power of what we do. And so, I just wanted to address it. And that's one of the big ways we helped you, and we help most people when they come in, move from being reactive to what's happening, which is easy to do right now with everything we just talked about, to being responsive. And a big part of that responsive is, you know what? If I look around, I'm okay. And if I keep doing what I'm doing, I'm going to be okay. And so I don't have to be worried about what's happening. And for the most part, we keep ourselves pretty safe. We're not driving into the Everglades and with a bunch of free food for the alligators and feeding them, right? We don't have lions, tigers, and bears running around, and we're not going to places that have them. So for the most part, we don't have anything to worry about. And that's a fantastic part of living, right? That gives you so much more energy to be able to enjoy what's happening.
Oh, yeah.
And what an opportunity.
Can I share another? You just reminded me of a story I haven't told in a while, but I love this, because this is when I knew that what you guys were doing for me personally was it really made sense. It clicked. And I loved all the initial stuff, all the early sessions and just the psychoeducation and the mind calming. It all made sense. But I think it was after maybe about this 12th session or something, I said, okay, let me just see this in action. But I wasn't testing it. I didn't realize that I was testing it. And I remember sitting in traffic, and it wasn't like a crazy stressor, but it was something that would have normally gotten me very reactive and very stressed. And, I was running late for an appointment that was important to me, stuck in traffic. There was some big car crash or something. And I had no control. Right. And I remember thinking, I regret that I'm going to be late or maybe even miss this appointment. It was important to me. I'm going to formulate a response and, make a phone call and just, sort of explain the situation. But I remember thinking, why am I not feeling sick? Like I used to internalize all this stuff, right? And it didn't have to be full-blown depression or anxiety. It was just the stress of all the little stuff every day, like sitting in traffic when you have absolutely no control, and missing an appointment that you had waited a long time for that was very important, and just thinking like, how come my neck didn't tighten up instantly? How come I don't have a tension headache? How come my stomach, it doesn't cramp up? You know, all the kind of physical manifestations, somatizing, right? And so you guys work, well, it sounds like exclusively with the brain, right? I noticed it in my body. That's when it made sense to me. I definitely felt calm the whole time I was going through the initial sessions, but when I didn't somatize and when I didn't feel sick anymore, I was like, I'm okay. I'm safe. This is all going to be all right. And then I thought back to the first time, Jeff, that I met you, and it was some sort of like crisis kind of situation, and not with you, but like, you know, someone dear to you. And I was like, why are you so calm and composed? And you're like, because I
happy.
Like, almost like a little inappropriately so, but I know, it was like, why aren't you more worried? I'm so worried right now. And you're like, it's all good. We're all good. It's going to be okay. And I was like, do you actually believe that? Like that was before I started all this work. And, but I think for a lot of people, and again, as you get into like, as we get older, right? And so we start sort of collecting aches and pains and medical conditions and high blood pressure and all the things that come with sort of just, you know, the aging process. You know, do we need to call it anti-aging, or do we need to just age more gracefully? And and so I was actually kind of thinking about, okay, so what people ask me now, people that knew me for a long time doing just hospital medicine, taking care of acute patients in crisis in the moment. Okay, Karen, like what are you doing now, you know, and with your career? And I almost feel like what I'm offering and what I've gleaned from the work that we've done together and we'll do more of together is, it's kind of like rather than, it's not behavioral health, right? Because I'm not a psychiatrist, but behavioral medicine, right? Sort of blending, you know, the way our, you know, thoughts, feelings, and emotions end up manifesting in our body and make us sick acutely in that, you know, in the moment sort of reactive phase, and chronically. What I'd like to really delve into more in the future, Jeff, you and I together, is how that stuff all compounds over the years, and in the actual physiologic impact it has on our body, our organs, our vascular system. You know, obviously they're all interrelated, but it takes its toll. And so when you start to see patients in their, you know, 50s, 60s, 70s, that, you know, oh, do we have a magic potion? Can we reverse all this? You know, this is a culmination of stress, and it is a learned behavior. And so if you're stressed by the time you're 30, maybe you're really stressed by the time you're 60, because you've had that many more years of practice with the fight or flight response or the reactivity. And so if at any point in time we can learn differently, right? A way to not have to be sick over every little thing or every big thing, you know, that happens. For the most part, we are safe, we are well, and we will all get through this, and we're good.
One of our viewers chatted that they had the same come to Jesus moment as well.
Nice.
I assume she was going through a rough time, and, you know, in the old days she would have felt sick, and right, she went through it, you know, like you said, gracefully.
Yeah.
So, yeah, I got to tell you, we help a lot of people. I mean, my executive assistant is 80. We have people on our staff that are in their 80s. You know, they do sessions all the time, and it helps for longevity. It helps to keep the neural pathways flowing. It helps undo. And a big part of that is that sleep, because sleep is our rejuvenative process, not just our resting process. And, you know, it's a big part of, once we stop stressing, you know, whatever system that all of our stress has been pouring into, we can actually start to heal it and actually start to rejuvenate. And that takes time. It takes a lot of work. And, well, I don't say work. It takes joyful energy creation, which is a intention, may take a little time on a daily basis. So anyway, I'm really excited. Yeah, I would love to work with you to do all those kind of studies. You know, we are applying for government grants, and we can apply for research grants. to do those kinds of things. And I'm looking forward to a long and fruitful association with you going forward. And
Beautiful.
so nice to have you on our team. I really appreciate it. And
Thank
so I guess I don't see any questions in our chat. So you have anything else that you wanted to bring up or say? Oh, I wanted to say something.
Oh, go ahead.
On your floor, you call it a concierge level. You actually have a concierge.
We have a concierge with a little bow tie, and
yeah, there was a guy there when we were there. He was like, "Hey, what can I get for you?" The newspaper and steak and lobster, and it was. I got to tell you that the facility is really top notch. I mean, it's really comfortable, and everyone's so friendly, and it's a beautiful setting too. If you're able to go out, I don't know if you are right now on the COVID thing, but go out to.
It's right on the intercoastal.
Yeah, it's absolutely beautiful there. So.
Yeah, thank you. Yeah, we like it. This unit was closed for like 7 months. I think they opened briefly when the pandemic. We thought we were out of the woods, and then stuff got kind of crazy here. But that's also a time when we all had to get a little creative, right? And sort of how we were going to continue doing what we do professionally, what we're passionate about, connecting with people. How do we connect with people when everybody has to isolate, So I think, we all have found ways to survive and thrive despite this. It's a blessing that this unit has been able to be opened back up, albeit with a few, extra precautions, of course. But of course, it's the nice thing about if somebody needs to come in here is that it is very private. It's very, low volume. We usually have maybe 1 or 2 patients at a time at the most. But it's quite safe. All the, high end precautions from a, infection control standpoint, but also absolutely everything we do, including myself, I make house calls. Like if I had to sit in an office all day, I don't know what I would do. So I love seeing people in their home, in their own environment, understanding kind of, how everything around them factors into their overall emotional and physical state of well-being. And everyone on our team, from all of our energy healers and therapists, recovery coaches, trauma specialists, hypnosis, acupuncture, massage, everyone that is on our team, first of all, does this from the heart with passion. We all come together. We all discuss every case because it's kind of like building a program around an individual. If somebody is really struggling from a behavioral health, mental health perspective or a substance use perspective, and they kind of have to go to a program, to go to a treatment center, we kind of turn that on its head. We create a program around that individual. And so, it can be anywhere from just an occasional check-in to one individual after another, all working in concert and sort of in unison to create, to walk that journey beside them in their healing and their recovery. And you guys have been gracious enough to kind of jump in at any point along the path. I know that's pretty, high tech stuff that you do. And some people, if they're really, really struggling, especially chemical induced, that some sort of neurofeedback providers might say like, no, you have to be off all substances and all chemicals out of your body. And boy, the first time you told me like, we can help calm the mind while you're going through sort of the withdrawal management, the detox, where they feel like they can't stop using, can't stop drinking because that's the only way they know to calm their mind. We can help. And I was like, thank you, please. Because the last thing I want to do is have to throw more medications on board when somebody's already trying to come off of another chemical, and so anything that we can do to help really just calm the mind and help them feel empowered. They're not out of control, right? Like we can understand our brain and we can put it to work for us. And that's what you guys have always been able to help me, my family, our patients with. And it's just so cool. And so cutting edge and unique. I haven't found any other organization that is doing quite what you're doing. And so.
Well, don't keep looking. You're not going to find them.
Thank you.
When we coordinate care, it's because we truly care. It's not just for the medical reason, right?
Yeah.
It's because we truly
absolutely.
Care. And anyway, I want to thank everybody. Jennifer is from Social Thinking. She's a fantastic advertising company. And Anna Margarita, I guess I'd have to call Anna Margarita our producer because she's running the show here. She's also does so much more for not just us, for really for the world, and helping people understand that they don't have to live the way the world tells you you have to live. And I'm really excited about working forward with you. Anything you would like us to add?
No, other than I think I'm not so great at like social media. I kind of have people that help me with that. But I think if you wanted to learn more about our program, that will be available on our Facebook page, Palm Beach Wellness Institute. And hopefully this will link us up somehow. And you can always just, give us a call. Let us know, where you are in your wellness or recovery journey at any point, and see how we could potentially, create a customized solution for you.
I think that's a really good point, actually, that it doesn't really matter where they are in the journey. And if they're on alcohol and drugs, or they're doing something that they just don't know how to stop, they don't have to stop before they come and see us.
Yeah. No, yeah.
Or they don't have to be ready to jump into detox. We can help them get to that point.
Perfect.
And we've done that for a lot of people, and we've had a lot of clients who come in, with a lot of pain and need extra help on that side too. And we help not just with the alcohol and the drugs or whatever the condition is that you're aware of. We help with pretty much everything that's contributing to that.
Yeah, the readiness.
That's a really exciting part of what we're doing. We're very holistic, which I guess is called integrative these days.
Yeah.
And I'm really excited. This is I love what I love what we do. I love helping people. I love watching the transformation. And it's just all my associations with you have been fantastic, and I've enjoyed helping your patients. And
thank you.
It's been great working with you, because you're so professional and your team is so great. So.
Thanks, Jeff.
All right, well, I guess we'll close up for the night. I think Anna wanted us to stay on. I'm not really sure. I think we're going to say goodbye.
Okay. Thank you very much.
Thank you.
Good night.